Now, this course deals with the exit phlebectomy. In essence, what this is just removing the first valve in a series of varicosities to unload the distal varicosities. This actually improves the outcome, as you'll see later in the course. This is an excellent way to take care of varicose veins and to do the minimal amount of incisions. Now, you can see in this photograph that we have here, the white arrows point to the first valvular dilatation. All varicosities are just valvular dilatations of one branch. The location of the exit phlebectomy is the first valvular dilatation. The concept is to remove this first valve that originates from the GSV or SSV. This downloads or unloads the varicosities distally, which we'll talk about in a minute. Most varicosities are just one branch with multiple dilatations. There is an exit point and a re-entry point, which we'll demonstrate in a little bit. By removing the first varicosity, the distal varices are decompressed due to lack of inflow. There is no trapped blood because the remaining varices will empty into the re-entry point, and the proximal varices will drain into the subdermal tissue. Now, there's minimal drainage that occurs once these are decompressed. The total volume is in the varicosities is actually very small. But you can see from this photograph we have here, we're removing the first varicosity. You can see with the insertion point RF catheter. Now, this is a schematic drawing of varicosities before treatment. You can see the GSV, there's an exit point, first varicosity, and you can see the re-entry point back into the GSV. Now, we'll show you in a minute what the exit phlebectomy looks like on schematic drawings. Now, you can see in this schematic drawing, the phlebectomy has been done at the site of the first valve. You can see that there's drainage of the blood into the subdermal tissues as well into the re-entry point. So in effect, what we have done is disconnect the varicosities by removing the first valve. Now, in this schematic drawing, the exit phlebectomy has been performed. You'll see the re-entry point is into the posterior tibial perforator. So varicosities in the lower calf will either re-enter into the saphenous vein or into a posterior tibial perforator for the most part.
Now, this is the exit phlebectomy, will be right here. This is the first valve that's dilated. Sometimes you can also take another one, but this is the exit phlebectomy, and we're going to foam this with 0.5% Ultrasound right before after we do the EVLT. Okay, here's the femoral vein, the junction, following the saphenous vein down. You can see a little valve right there. Now, as we go down, you can see right here is the saphenous still, a little bit superficial, but the first branch that we're going to see is right there. That's the saphenous vein to the left now, distally, small size. These are the varicosities that come off of it. So the exit phlebectomy will be right there. The rest of them will foam. Okay. Under ultrasound, I'm just cannulating the last varicosity. You can see it's right there. And then we're going to inject foam. Down below that, it re-enters into the saphenous vein. And I'll inject the foam in just a second. Okay.
Our preferred dosage is Sotradecol 0.5% foam or Polidocanol 1% foam. Now, this is injected under ultrasound guidance, as we showed you, with the patient in the supine position after the RF or laser ablation of the saphenous vein is done. By doing the exit phlebectomy, thrombosis of the residual varices will not occur. If you do not do the exit phlebectomy, then in essence you have an area of trapped blood, and thrombosis will occur, and it will take a long time to resolve. You'll have to drain it. You'll get discoloration of the tissue from the hemosiderin deposition. The patient will be uncomfortable. By doing a simple maneuver of exit phlebectomy, you're going to have a much better cosmetic result and a much better postoperative course.
Now here's the foam in the varicosities. We're scanning down towards the ankle. You're going to see in a minute that this re-enters into the distal saphenous right there. And that doesn't have any foam in it. These are the proximal saphenous does, but the distal is fine. Right there's the distal saphenous. All these vessels re-enter into the distal saphenous. And there's the foam and the varicosities. And the next thing you'll see is when I do the exit, take out the first varicosity, which is right there. Okay. Now here's the entrance site for the laser. Here's the first varicosity right here, made a little nick with 11 blade. We're going to just kind of tease this out, get out as much as we can. The clamp. You can see it's coming out nicely. And this is distally here. This is proximally. So we're going to just tease this out a little bit more underneath here. This is the valve right here, the first valve. That's bad. Scissors. And we just divide it. We're going to mobilize it a little bit further. And that's it. It's the exit phlebectomy. We avulse the vein, so now it's open here and open to this part where we did the ablation. So we try to milk out any foam that we can, decrease the amount of trapped blood, and this really dissipates very rapidly, and the vein usually doesn't clot up because remember it drains back into the saphenous, and now it's open here into the tissue. Okay.
Now, for the postoperative dressing, we use Dermica cream. We cut the pool noodle to the specified size that we want. We place it over the treated varicosities with foam. Then we apply a 3-layer wrap. The dressing should remain on for at least 2 days. Now, this is the appearance of the leg 7 days post-procedure. You can see an excellent cosmetic result. In the upper portion of the photo on the right side, you can see the small incision that was done for the exit phlebectomy. So this is an excellent result. These are the type of results that you expect when doing this. And the patient has an excellent result with minimal postoperative bruising or minimal postoperative thrombosis in the varicosities that were treated. The other option is to do multiple stab avulsion phlebectomies. However, this is a much easier procedure and gives a better cosmetic result.